Executive Director for medx, and it's a real honor here to be here today to honor the nurses and those that have served our community so well. And I do have to give accolades to Jessica as well. She was one that I texted quite frequently in the beginning as we started to unravel the testing issues with COVID and not knowing some of the implications of what that meant and getting access to those services. And so she was incredibly instrumental in helping us stay in service and being able to perform what we needed to perform. So again, Jessica, thank you for everything that you've done. So it's a great honor to be able to be speaking to you here today. So as you saw, half of the video, we provide emergency medical transport services to this community, mostly in northern Nevada, predominantly here in Elko and then also in Ely and Winnemucca. Nurses serve a critical role for our organization in patient care, leadership, and clinical education. We would not be able to provide such a critical service to this community without dedicated nurses who day in and day out provide care for patients in their moment of need. We are here to honor those in our community who have taken on the trusted role of nursing. These individuals today have embodied the necessary attributes and skills needed to be called a nurse. They honor us with their presence today, and our community is better because of their efforts and dedication to us as nurses. The individuals who are being honored today began their journey in nursing by subjecting themselves to the rigor of nursing school. In keeping with the theme, which is today of stories of resilience and adversity, I can think of no better example of what constitutes adversity than nursing school. I myself am not a nurse. I chose to take the easy route and I became a paramedic. My program was housed in the same health sciences building as the nursing program. I witnessed many tears from the nursing students as they endured long, difficult lectures, labs, and exams that nursing school requires of them. Many of them were single mothers who worked full-time jobs on top of nursing school in order to survive. Nursing school is not easy, and for them to complete it is an example of resiliency I can only hope to aspire to. With nursing school behind them, entering the field as a new grad is the next step in their progress. The first job for new grad nurses is an opportunity for them to hone their skills learned in school and develop their proficiency as a patient care provider. This presents a whole new set of challenges that again demonstrate the stories that each, this presents a whole new set of challenges that again demonstrate the stories that each nurse writes where they overcome adversity with resilience. As their careers progress, they may move into positions or organizations as they understand what direction their career is going to take them. Some find excitement in emergency medicine, while some find fulfillment in a clinic providing necessary care to underserved patients. At this point, it may seem like they have endured enough adversity. However, life still continues to throw them curveballs with adversity. Nurses care for many people who have endured trauma and difficulty. What is not commonly known is the struggles and challenges that everyday life brings to the nurses themselves. In the 3 years I have been in my leadership role with medx, I am amazed at the life challenges that our healthcare heroes face in their daily lives on top of caring for people on their worst day imaginable. Our country has endured an unprecedented pandemic that has tested the healthcare community like never before. While nurses were battling at work, they were also battling at home. One nurse that comes to mind is a nurse that works for our organization. Not long after joining medx, the medx team, the pandemic began, and that presented its own set of challenges of being a new flight nurse, as well as enduring a pandemic and all of the things that presented to us as a healthcare organization. But not long after she had joined us and the pandemic began, she received news that no one wants to hear. She was diagnosed with metastatic breast cancer. Her treatment would require aggressive therapy that would affect her health, her body, her self-esteem, and her outlook on life. During the chaos of a pandemic, she underwent a double mastectomy to prevent further complications of her conditions. She is a mother, a daughter, a wife, and a survivor. She's got a great attitude, and it's amazing that she was able to overcome such an adverse trial in her life. During the pandemic, several other nurses that we employ within our organization dealt with tragic family loss, financial hardships, childcare dilemmas, marital stress, and much, much more. Despite all of these battles, these nurses continue to be the support structure for an entire community and nation while everything seemed to be falling apart. The vision of our future in this community is felt to be a little brighter today, thanks to these nurses being honored today. As they continue to serve and care for those in need, we will be forever grateful for their selflessness and dedication to our community. Thank you.